I'm here today at the office of Dr. Marcus Lacerda. Lacerda? How did I say that?
Lacerda.
I'm here today at the medical offices. I'm here today at the medical offices of Marcus Lacerda. Give me a second. Go ahead and end that and restart.
Really? Okay.
Here today at the medical offices of Marcus Lacerda. Dr. Marcus Lacerda has been leading research in infectious diseases for a very long time, long before COVID-19 came around. He's been doing everything from malaria, yellow fever, dengue fever, everything, AIDS, anything it's an extremely infectious disease. This man's researching for a very long time. And only he does here in the state of Amazonas, in Brazil, but also the man travels around the world. The man is a genius in what he does. Now this doctor will say he isn't like, if something's a problem, he will tell you it's a problem. If he doesn't exaggerate anything. If like I got paranoid and I asked him things and he's like, oh, don't worry about it, you can come here, he's fine. Like before I came here the first time, where this reinfection hit, he said it went down, toned down. Now he's telling me it's going back up again. But if there is something that's not a really huge thing, he's very honest about it. But if he says it's a problem, listen to him. It's a problem. That's a critical thing to keep in mind when talking to this man. Now I'm also going to ask him today about the whole thing of the new COVID strain, because the new COVID strain here is it's different. I'm not a doctor, so I'll let him explain, but it's a different variant of the strain than what we're used to. So what happened here in Manaus was everybody got sick. It was like one of the worst in the world. Many people died. And then basically herd immunity kicked in. However, now a new strain has come out, so even though people have got it and had the immunity from that, they're getting reinfected from the new strain, which also means that vaccines will still work, but not as good, because this new strain can actually, I'll let him explain, from what I understand, it actually can avoid the immune system, and it's more infectious. There's a lot of problems with it. So I'm going to try to talk to him about that, and also ask him about masks like this. I wear this one out in Staehle stores. I have this one. I also have the one I'm wearing right here, and I have, of course, the old cloth mask. You know, which mask is it effective? What works? You know, what do we really need to do to protect ourselves?
Mask for BlackJack. Yeah. Mask for BlackJack. Mask for BlackJack. Yeah.
Up on the grass, right? I already stepped on the grass. Pick up monkeys, no problem.
Yeah.
Pick up monkeys, no problem.
Yeah. Mask for BlackJack. Yeah.
Absolutely huge. I think it's
Yeah. Mask for BlackJack. Yeah.
absolutely huge.
Yeah.
Massive. Pick up monkeys, no problem.
You got the elevator now. I don't know if the thing that's really actually 2 meters that they cross. There's no numbers. Everything here is secured, so they have to. It's like a program downstairs. Security guy selects what floor you go to, so you have to go to where the security guy sends you to. Really secure building. Here it is.
All right. Got you going. I've been really following your COVID-19 stuff, and I noticed here that you all kind of were like ground zero. You all had this huge mass infection. A lot of people got sick. A lot of people died, if I'm not mistaken. And then it was almost like a herd immunity kind of.
Yeah.
Now you're going for a
Yeah,
second.
the problem is that herd immunity does not last forever, right? Because the antibodies, they start to decay after a certain amount of time. We were not aware of that. We thought this immunity would last longer, but apparently the level of antibodies has started to decrease. And at the same time, when the virus faces 70–80% of the population with antibodies, the only way for him to keep existing is to change. So the virus has changed. So now apparently we are having more reinfections. So people who were infected there in the first big hit, March, April, they're becoming infected again. Especially those who did not develop as many antibodies as they could. So actually it's a lot of things that explain the second wave. The first one is that we are living in the seasonal time of the year when you have respiratory infections. It's different from the rest of the country. So Manaus is very similar to what you have in the US. We usually face flu outbreaks about the same time that you have in the US because it's your winter. Actually, it's not winter here, but they call it here the Amazon winter, right?
The rainy season, yeah.
Yeah, because the rainy season, you have lower temperatures, it's raining all the time, so they call it the winter here, and that helps to develop respiratory. The second thing is that people are losing antibodies. The third one, you have a new variant of the virus. It was described for the first time by the Japanese tourists who were here, came back to Japan. Japan is they're very precise. Anyone coming from another place, they have to be quarantined. So people got sick there, 4 tourists got sick, they got the virus and they saw that it was a new variant. It was about the same time that we were doing the sequence of the virus here that started in December. So this new virus has very similar mutations to those mutations that they've seen in the UK and South Africa. So apparently the virus is changing all over. You have very similar mutations, but they're happening in very different isolated places. So this new variant, we call it now P1. Yeah. And we don't have much information about the variant, but when we see patients now, we see that the entire family is sick now. It's not only 1 or 2 in the house. We have more people sick. So we hypothesize that you have a more infectious virus, which is pretty much explainable. So the virus makes mutations, and when these mutations have advantages for the virus, they survive more than the others. So nowadays we have almost 90% of the infections here are due to P1. And since we did not close borders, the variant is already spreading. It was detected in the US yesterday, I think. They got the new variant there.
Yes.
In the UK, in the rest of the country, they're already detecting the variant. So it's very possible that the new variant will spread all over.
Very quickly.
We have no information about if it's more lethal or not. The lethality has increased here substantially, but probably because we have more infected people and less hospital beds. So you have also followed the crisis in the oxygen supplies that happened here. So the oxygen, we can produce 29,000 cubic meters of oxygen here per day. We started to use 90,000 per day. So it's almost 3 times what we were able to generate.
Oh wow.
And keep in mind that you cannot make this transportation in regular airplanes. So you need different types of airplanes. The capacity is not very, very big. And you don't have roads. So it becomes very complicated when you need extra oxygen in a place isolated like Manaus. And that might be a problem as well in the countryside.
Yes.
because you have been to Tottenham before, you know how difficult it is to come to these places. Yeah, sometimes you need like 10 days to go by boat, so it will become a logistic problem, especially for the countryside, to give these people full access to oxygen. And these people, they don't have intensive care units, so it's a huge crisis which should not be exclusive from Manaus or the Amazonas state. I mean, most of the systems, they have already started to collapse. When you look at Rio and São Paulo, Porto Velho, which is in the Amazon as well, but more to the south, they also collapsed in terms of hospital beds. So unfortunately, it got too long to get people vaccinated. I think that's the major concern that we have nowadays. Probably the government should have started earlier. I don't think that they were skeptical about a second wave enough to get people vaccinated. In Brazil, we have two very good public labs which produce vaccines. The first one is Mutation, which is the one that has given the first doses of the vaccine in the 17th of January. And Fiocruz, which has not started to produce yet because the agreement they have with AstraZeneca of Oxford vaccine, supposedly they will receive the first reagents to get vaccines produced from February on. So the government should have bought more vaccines, and they didn't. Actually, they refused to buy vaccines and to be in the big group of countries negotiating vaccines worldwide. For example, I think that nowadays the US has probably 4 types of different vaccines being used. And Brazil decided to use only the vaccines produced here and did not negotiate more vaccines. So that was probably the major mistake. So nowadays we don't have vaccines enough to vaccinate everybody. We're still vaccinating health professionals. They've started yesterday to vaccinate elderlies who were in some, how do you say that? Some homes.
Like nursing homes?
Nursing homes, yeah. They started yesterday. But we still have a lot of elderlies to be vaccinated in the whole country. And then you have to vaccinate the young adults as well, because if you do not do this, you will never have the real herd immunity that you need to control the outbreak. So I think that this week private hospitals, they started to have some type of relief in terms of number of beds. And I think that the holidays contributed a lot to that explosion of cases, because a lot of people could not be isolated anymore, so they wanted to convene because of the holidays. And actually that's what we saw. Lots of parties, people, even not being allowed, people did some private parties. That all started because of the parties around October, November.
Makes a lot more sense.
Yeah. So many things happened at the same time, which led to this, which triggered all this crisis. It's very sad. Because sometimes I have patients here that I see and I cannot send them to the hospital because there are no more beds in the hospitals. So it's really critical. And because of that, people wanted to have their own oxygen at home. So everybody started to buy oxygen. So you don't have enough oxygen for the hospitals, and then you have families going to buy oxygen, cylinders of oxygen to stay there at home just in case you're sick. So they're still trying to solve the issue. The government, the federal government has sent some oxygen to Venezuela government has sent some oxygen by road as well. It's the closest place we have by road here in Venezuela. And the Ministry of Health also contributed to the crisis by taking patients from here to other states. So hundreds of patients were already removed to other states to the intensive care units. It was of great help, but we don't know if the other states will still be receiving our patients because they will have to hospitalize their own patients.
Yes.
For example, private patients that I see here, when they're wealthy people, I used to send them to São Paulo, to the private hospitals that I rely on. But even there, the number of beds is not illimited. You already have hospitals without beds.
That's scary.
Yeah, that's scary. I mean, the situation in the U.S. is not less scary, right? I think that this political-driven management of the crisis by both of our presidents has contributed a lot. The way they denied the pandemic, the way they did not thought ahead in terms of buying more vaccines, that was crucial for the crisis. Using useless drugs, you probably have followed all that happened here when I did the first trial.
Yeah.
It worked. It helped a lot the American people to decrease the prescription of mortality. When we got our paper published in JAMA, the next week or so, the number of prescriptions in the U.S. dropped dramatically. But here, for some reason, they refused to believe the paper, the study. And more than that, they started to spread fake news saying that I have killed people in purple just because I was against the president. So until now, I am responding to several people who have sued me just based on the fake news spread by the president and his supporters. So it was really crap.
Yeah, that's great.
Yeah, that was crap. It all started by someone who worked for Donald Trump. He was a digital influencer, and he said in his Twitter that we were killing patients in Brazil like guinea pigs just to prove that the drug didn't work.
That's ridiculous.
And then it all started, this wave of disbelief in the trial. And fortunately, afterwards, many other trials confirmed that the drug didn't work. But they've lost a lot of time debating about the drug. And by doing so, they've lost a lot of time which could have been spent buying vaccines, discussing, planning oxygen supplies, a number of beds, intensive care unit beds, training of personnel, because nowadays you actually don't need chloroquine, you need well-trained staff to take care of you in case you go to the ICU. And that never happened. Nobody was never properly trained technically to tackle the disease. So WHO 2 days ago released the new guideline for the management of COVID-19. And the physicians here, they simply don't read the guidelines. They prefer to prescribe their own drugs based on their political will.
Wow.
So it's still very sad to see physicians prescribing vitamins and ivermectin, It's totally crazy.
That's insane.
Even the infectious disease, the Brazilian Society for Infectious Diseases here, there was a lot of disbelief. Those are the people who actually understand about the disease and they give all the guidelines. But for some reason they were also sued, and it's amazing how politics
Yeah.
changed completely the way we could have behaved during the outbreak, because different from the US, we have a public system here. So it's totally different from the US. I mean, if you go to the hospital now, you will not pay a penny.
Yes.
Right? It's totally socialized. So because of that, it could be an advantage of our system to have this type of approach. I know many people who could not have beds in the private hospitals, but they've got a bed in the public hospital. And they are not necessarily worse than the private hospitals. The first hospital which was totally adapted and closed for COVID-19 management, which is the Aziz, which is in the northern part of the city, they have a very good staff and guidelines. That's where I worked in the very beginning for the chloroquine trial. So, I mean, we could have been a nation with much better results at the end if we had more leadership. I think that a lack of leadership made things very difficult.
So it's scary. It's crazy trying to find a hospital in birth that you call around like, no, the hospitals aren't named by it. With COVID-19.
We're going to a public one.
We tried private and public. We finally found a clinic that said that they would we could pay and go to the clinic environment. Finding a hospital or a birth at it's impossible. Everybody was maxed out as COVID-19.
And I think that in all these clinics, they also are hospitalizing COVID-19 patients, especially if they're pregnant women, so you have more beds now dedicated to COVID-19. Yes. But the pregnancy is going well. It's not a high-risk pregnancy, I assume, so things should go well.
So far, so good. I know it's been scary going on. It's like when I was at Colchicine, what blew me away is everywhere announced the mask, everyone's precautions, and Colchicine, it hit so hard, they had 20 deaths. But
20?
I think it's 20, was it more than 20? More than 20 Colchicine?
Probably, yeah.
They had a little thing out there.
I remember that you called me once
Yes.
and you were there because
Yes.
people were not using
No
masks.
masks, distancing, nothing. Parties, all those things, everybody's all together for our grandfather's 90th birthday party. So just I went to the hospital there. They said they had supposedly one person in the hospital, but they also had a large number of people at home. They were treating COVID-19, but that was before this whole new variant came out. So my fear is, with them being so lax and this new variant getting there, it'd be devastating. Something like that.
And her parents are there or here?
Her mother is here now. Her father is there in Manaus. Her mother and her brother just got to Dunhee, I think it is.
Yeah.
They said they thought they had that down there. Now, when I went to Dunhee, I got down there. I felt kind of sick. I had a fever for a little while. I went to the hospital. They had me in and out there pretty quick. But it was COVID. I don't know what it was. But I felt sick, and then I got better. It was fine. But it's the first thing.
And you yourself, did you get any infection?
Fluid. They said everything looks good, so I just need some fluid to be on my way. And they gave me some antibiotic medicine also. But no, I was worried much. I saw the fever and everything, but they said now my fever's gone down, so I was a little bit nervous. But it's very fast. I got seen as soon as I came in. Went back, saw the doctor, got help right away. It was very impressive and very fast. So, and this place is not overly packed with people, and I don't see things like people think it'd be fearing, especially not wearing masks. But here it's very calm. It's not, like I said, overcrowded or anything like that. And everything, like I said, they're helping me. Everything is very good, very, very, very good. So, I'm very impressed.
Are they kind of isolated?
Yes. My father is petrified by the virus, so he's very, very extremely isolated. The mom's getting more, going out a little bit more. But he's scared.
That's the Middle West, right?
Yes, Kentucky. Pretty similar. No, he's a little bit east side, that way, southeast area. It's
Because
scary.
from what I read, you had several waves in the US, right?
Yes, that is correct.
That all started from the East Coast and then started to go more to the West.
Yes, and the sister state, Washington, Seattle, they got hit there like really, really bad at first, and then it spread so quickly. That's our-
And you're still in the show? No.
Yeah, we're on temporarily on hold, and right now too, the whole COVID-19 thing, ain't nobody's rattling COVID-19 by any means right now. So we're kind of like in a break, really going on.
Right.
Another question I have for you is, I noticed all these different types of masks. Like, does it make a difference on like the face shield or like the respirators or like this or N95 I was good or like this? Does it make a difference in what we should use?
Well, actually, there was a campaign last year stimulating people to use any type of fabric because people were not using anything and they were still very lost in terms of what to be used. If you're a professional and you are in a hospital because of the aerosols,
Yes.
you need the N95 because it blocks 95% of the small microorganisms. But apparently the droplets when you speak or when you sneeze, 80-90% of them are blocked by this regular fabric mask. So it avoids more the transmission to someone else than avoids you from getting infected.
Ah, so where?
So you're actually protecting the
Other
others
people.
when you use it, not yourself.
Ah, okay.
Okay, so what you're doing now here, for example, if I am contaminated and I sneeze here, for example,
I'd get it.
these will not
Protect me.
Yeah,
Oh,
these will not block.
Okay, so this,
Okay.
so that's where the face shield or like the actual.
Yeah, so the face shield will avoid droplets as well. If people are talking to you here, the face shield will help a lot, but not from the lateral. So when you're using the face shield here, if someone sneezes or talks
That way.
that way,
That way.
so it's essentially for those who are seeing customers, for example, you know. We're talking to a patient here, so if the patient has no mask, for example, that will help protect you. So it's essentially the same thing, and the more layers that you have, the better. So they stimulate you to use at least 2 layers, like the one we have here. That decreases a lot the possibility of the droplet to spread out, right? But again, it gives less protection, of course, than this type of mask.
Yeah.
The thing is that we could not produce as many masks as possible. So that's why people started to use this fabric, and as time went by, they realized that that was a good protection. What we are seeing now with the new variants is that it's becoming more and more complex to avoid transmission. We don't know what's happening to the virus, if it persists more on the surfaces. We don't know, but it's more infectious to some extent. Like I told you, in a family now, I see everybody sick. And yeah, last year we used it to see 1 or 2 people sick in the house, but now everybody is infected.
I read somewhere that I've seen where they found it, I think at one time, salmon and then ice cream, it'd be transmitted through food also.
Yeah, there are some studies showing that, for example, when you go to these fairs, sometimes people are touching. It's very common here for people to touch the fruits and the fish and everything. So probably that contributes to transmission as well, because the virus will be there for a while, sometimes even for hours. So it's not improbable that you're, picking your orange, you don't like that orange, you put it back, and then someone comes and takes it. So more than respiratory transmission, the contact transmission seems to be very efficacious.
Orally consuming as well.
Yeah.
Oh wow.
Yeah.
So is a mask like this overkill? Or is it overkill with a face shield and the respirator on?
Yeah, no, that's a very good mask. The problem is obviously the price, the cost.
Yeah.
Not many people are able to buy it. And here, the other advantage of the face shield is that it blocks droplets in your eyes, because you can also be infected through the eyes. Any type of mucosal contact of the virus, you can become infected. So the face shield has these two advantages. For example, there are studies showing that when you use glasses, you contaminate glass, because when someone's talking to you with the glasses, you're naturally more protected against the droplets in your eyes. But well, as I told you, with these new variants, it's becoming very difficult even for all these masks to protect you 100% from the virus, because it persists more in the surfaces. Everything is becoming more and more complex. The virus also wants to survive. We are human beings trying to use whatever we know, which is the capacity to produce vaccines, but the virus has his ways as well to survive as much as it can.
So with the vaccines going out, the new variants, will the vaccines have a really good effect, or the new vaccines?
There was a press release yesterday. So what Moderna did and some other producers are doing is that they're taking the neutralizing antibodies from people who were vaccinated, and in the laboratory they're trying to see if those antibodies they can block the entrance of viruses inside cells. So what Moderna concluded is that those variants from the UK, South Africa, they still can be blocked by these neutralizing antibodies. So all the vaccine producers are taking new variants and checking if their vaccines are able to block the virus as well. So that comes from laboratory analysis, and so far what we know is that the new variants, they can still be neutralized by the antibodies treated by those vaccines. So that's what we know so far, but there are new variants and they're tested. So it's ongoing experiments to guarantee that you still are very well covered by the vaccines. Naturally, by the time you have new variants and they predominate, of course, these vaccines will need to be updated. So that's the major concern. If you need to update your platform with new, especially those who use the viruses, the whole virus, those vaccines will need to be updated with the new variants.
So is it highly possible that like every year we have seasonal flu? They'll just do seasonal.
Yeah, apparently that's what's going to happen.
Yeah.
We're still learning. Keep in mind that we have no more than 1 year after all this shit started. But apparently that's what's going to happen. I think that the viruses change very fast. We are used to these big changes in the other hosts. In the case of coronaviruses, camels or bats, which was this case here. So you have more modifications, more mutations in those other hosts. But the human being has become a major host because of the number of people infected. So the virus is being able to make mutations even in human beings. Because for influenza, for example, the major change they happen in pigs and in birds. It's not in human beings that the influenza viruses, they change every year. It's in the other hosts, the other animals. But in the case of coronavirus, we are behaving as birds. Human beings are like, birds, because it's such a huge amount of people that the number of generations of the virus is leading to mutations. So it's very probable that we're going to have to update the vaccine platforms over time. Very probable.
Possibly maybe more than one vaccine a year, or even more a year.
We have no idea. I mean, the first vaccinated population is still being followed up. So we have to check the amount of antibodies of these vaccinated population over time. So we still need to follow these people up to check how long it lasts, because the natural infection apparently does not lead to a sustainable protection over time. Even those who were naturally infected by the virus, you see that there is a decay in the amount of antibodies. So it's very likely that the vaccine will not be better than the natural infection. Usually the vaccine is worse than the natural infection. So if the natural infection does not lead to sustainable immunity, it's very unlikely that the vaccine will be safe.
That's scary.
It is. And that's why we need 2 doses of the vaccine. I mean, if you have something that leads to very good immunity, 1 dose is okay. But all the vaccines that tried to use 1 single dose had to change to 2 doses, showing that immunity needs a booster. So immunity is not very good. That's why you need 2 doses.
Is there anything specific, I guess, like drinking a lot of fluids, taking like certain vitamins?
Well, we actually have no idea on what's the benefit of these supplements that have started all over. For other diseases, the better your immune system is, the better in terms of the infection. This virus has this prevalence for obese patients, hypertense, arterial hypertension, and diabetes, and men. Keep in mind that it's a very male disease.
To say that it's the same thing. It's everybody pretty much died down there had something like that as well.
So we are still trying to understand why this population are increased risk of severe disease, but that's what we know until now. I mean, we don't know exactly what type of supplement or what type of medication is able to give you a better defense against the virus. We have many indications from the literature, for example, that if you have a deficiency in vitamin D, usually you have more severe disease that came from Europe in the first wave. But it does not mean at the same time that when you get sick, you need to supplement with vitamin D, because that takes a while to act. It's not necessarily you got sick now and you take vitamin D and you will survive. It's not that fast for vitamins to act. So people are making a big confusion in terms of what you need to take to avoid COVID-19 and what should they take when they become infected. So far, the only thing that we know that acts in the first week is Colchicine, there was a press release last week showing that Colchicine decreased, when you use it in the first week, decreases the amount of severe disease in patients. So it's something that we're still waiting for the paper, for the final publication, but the press release was very enthusiastic about the use of Colchicine in the first days of symptoms.
That actually helps with the process of actually fighting the virus.
Well, Colchicine is an anti-inflammatory, so apparently it prevents the second stage of inflammation. That decreases substantially the number of hospitalizations and deaths when you use it in the first week. But we're still waiting for the final publication to judge better how the data confirms that. They've followed more than 4,000 patients. So it's a substantial work.
It's a lot of really good information.
Yeah. So because of that, we have already started to prescribe Colchicine to patients, but we're still pending on that full information to be prescribed that. But it's apparently the first drug that actually works in a preventive way when you use it in the first week to prevent the development of severe disease Well, essentially, the inflammation in the lungs, that's what kills patients. So the virus replicates the first week, and in the second week, it leaves in some part of the population, 5% of them will have a full inflammation of the lungs, and that's what kills people.
That's where the medication goes.
Yeah, so the medication apparently will decrease or prevent this inflammation in the second week. We already know from the English study that when in the second week you have severe disease, so you have this big inflammation, corticosteroids, they help a lot. So we have been using for a long time. After this study was released, we were using corticosteroids, not in the first week, but in the second week when people get really sick. So that's the only indication for steroids. You do not need to use steroids in everybody. If you use steroids in people without the proper indication, they could eventually die more. So there is a specific timing to use steroids in COVID-19 that has to be clear to everybody.
Is it not going to actually increase the risk of fatalities?
Increase what?
I would say is if you don't do it properly, you increase the risk of fatalities.
Oh yeah, sure.
Wow.
Sure. All the trials performed with steroids showed the same thing. There was one paper from the UK recovery trial and our trial here in Manaus, the medical trial, and we essentially showed the same thing. That if you use it properly, you have more fatalities. So you have to use when you have the real indication in people with inflammation in the second week.
It's a really good doctor to make sure they take care of that.
Yeah.
Scary.
Well, the guidelines are there. They were released, and I think that people really need to keep updated.
Yes.
In the guidelines, the CDC has good guidelines, WHO has good guidelines, and I think that people have to stop doing their own way to treat COVID-19. Of course, we don't know that much, but we know a lot. After 1 year, we already know a lot about COVID-19, and I think that physicians and health professionals in general, they have to try to focus on the real evidence and what they need to do. Otherwise, they're going to be eventually killing more people than helping people. So that happened with chloroquine. So chloroquine probably is responsible for an additional 20% of mortality in people with COVID-19 because it was used without any indication. And because of the risk of arrhythmias in these patients, in all the papers, when you read, you're going to see that there is this trend in more fatalities when they use chloroquine. So it's definitely not indicated anymore. Only in places like Brazil, I think there is still this discussion on whether you should use or not chloroquine, but all the decent countries are not prescribing that anymore.
After you see AIDS, yellow fever, dengue fever, you see so many different types of in the whole area. Is COVID more fatal or worse than all of them? Or what's your opinion?
Well, I think that because of the collapse in the system, you obviously see more death is related to that. I think it's more related to the absolute number of cases than the percentage of fatality. Okay?
Even it's more
because
lethal, it's more infectious. You have
yeah,
more
exactly.
deaths.
So the total number is higher. So of course you see much more cases. We are burying today around 200 patients a day in Manaus. The average number of burials is 40. So we have an excess of deaths of around 160 patients who are dying, probably because of COVID-19. The confirmed cases are much less, but there's a lot of people who are dying at home. They don't even go to the hospital. They die at home and then they're buried. So the best way to see the probable number of cases of COVID-19 is when you go to the cemeteries.
Yeah.
That reflects the real number of cases for
All that documented, yeah. I went to the cemetery, went there, we were some filming, and it was locked off. There was like hearse after hearse after hearse going in there. It's scary.
It's really scary. I live close to the cemetery, and the traffic is always very heavy because of that. The funerals.
It's all firsthand.
That's not that was not an easy year for all of us. We really hope that to have an end, because we're totally burned out. At home we tend to give attention to our families. Children are not at school.
Yeah.
You still have very young boy, but when they are at school and they can't go to school, they're playing PlayStation all day and night. They're not learning. That really makes me freak out.
Oh, understandable, yeah. And they do class on tablets all the time.
Exactly. The future of this generation certainly will have some impact. Of these 2 years.
Scary.
There will be some gap in terms of learning and education is going to be definitely impacted by that, unfortunately.
Because everybody at home and they're making your tablet and you get electronics and not socializing as well. Other quick question. I have one of these at home now. As long as your blood oxygen level is, when should you be worried? Like mine's always above 90. Usually around 90.
So when it's below 90, it means that you already need oxygen. Okay, but when it's below 95, that's when you should be scared, and that's when we indicate steroids. So essentially, that happens in the second week. Okay, never in the first week. It's always normal in the first week. But it's a very interesting device because everybody has full access to that.
Yes.
So nowadays, if you're sick, keep in mind that in the second week, if you have this saturation lower than 95, it's the right time to use steroids, and that should keep you okay. And even if you're using steroids, you have the saturation below 90, that's when you need oxygen. So that's helping a lot now as compared to the first wave when we didn't know anything about that. So we waited people to have symptoms, breath shortage, to go to the hospital. But the fact is that when you have this decrease, you still don't see breath shortage. So people are okay. They do not complain about anything, but their saturation, their oxygen, the blood is already low. So that helped a lot to save more lives, because you can take these people to the hospital before they have the very severe COVID-19.
And then also when you're going through, like let's say somebody has 95 below, not that I'm like think of this, of course they shouldn't travel on air travel anyway, but when you travel by air, your oxygen goes down when you're in the air, correct?
Right.
So it's not a good idea to provide air travel, obviously because of that as well, I'm assuming.
Oh yeah, because when you have this very low saturation, you actually need to be in an ICU, air ICU, because then you're going to need oxygen.
Yeah.
As you said, that could decrease during the flight. So people, when they're transferred to other states, they need specific aircrafts who are able to give them oxygen supply while they're traveling.
Because otherwise, of course,
Yeah. Are you confident that I told you?
I'm very confident. I've actually learned a lot of stuff, actually. I've been studying a lot of stuff because before I came to Brazil, I was with yellow fever, done me trying to look at all this stuff.
Yeah.
And then, of course, then coronavirus hit. And that's why I was in Colchicine. I was so shocked. Like, there's no one wearing masks, no one was distancing, nothing there. Like, the grandfather's party, all these people. And it was, like, I think at times they really
Yeah,
love
I think that the countryside, in my opinion, if they have closed borders and all the sheep go there, they could have avoided a lot of deaths. But they've closed the countryside not in a timely manner. It took too long for them to close the flights and the boats and everything. And the same is happening now. We have already found P1 variant in more than 10 municipalities in the countryside, so it has already spread.
It's a lot better in time. Hopefully it won't get as bad. Well, if it does, it potentially get worse than it was before.
Yeah, I think.
Oh, God.
Yeah, I think it's going to be much worse. Much worse. It's much more infective. Much more infective.
So the elderly, so what, I mean, isolating themselves as best they can, but I guess they wear, I guess they need to wear N95 masks. I mean, the ideal thing to do also.
Well, yeah, I think that isolation is still the best thing to do. I mean,
Yes.
people are still locked down.
Yeah.
You know, that's what really works. Because when you go outside and you're wearing a mask, eventually you're touching something, you know.
Takes one person to infect the entire
Yeah,
family.
and you do like that. Sometimes masks, they cannot avoid 100%. So the best thing actually to do is to be locked down. A proper lockdown is still the most effective way to decrease number of cases.
If you have a virus that's course, and it doesn't.
Yeah, I mean, I know it comes from the Middle Age, the fact that you have to be locked down, but it's still what works. If you don't have
Yeah, it works.
it works.
Yes.
It works.
One person gets a virus, brings back the whole family. And
Yeah, you know that most of these physicians during the plague, they used that to come inside, but actually they were making a lot of money because they were selling herbs and all types of chloroquines to people. So they became very wealthy, and they used to have a diary in which they used to write what they saw, because in case they died, their diary would be kept.
Oh wow.
For the others to see what they've seen inside the cities they got into. But yeah, we're coming back to the Middle Age. It's
Different types of masks now.
yeah. Well, I think that gives a good picture. Let's not take one side. That would make a good picture. The
Paul?
old and the new.
Paul?
Yeah.
The maximum size already reached.
Yeah, new clip.
I don't know, maybe you have still 5 minutes or 10 minutes.
Yeah, that's a good shot.
That is too funny though.
Yeah, it's the old 3M and the new 3M.
That's funny.
Okay, guys, I still have patience to see.
sorry.
The crowds are down there waiting for me.
Yep. We had a great time talking to Marcus. Everything was great. A lot of learning experience and everything. So hope you'll enjoy it. Hope you all learned a lot of stuff.